How many of you really know your family mental health history? I'm going to give you some tips that will help facilitate this and allow you to be empowered and know much more about your family mental health. A lot of times during reunions, holidays, and life events, we gather with our family. During this time, we share the occasion, we share epic stories, and talk about the family tree. The one part that is omitted from these conversations is our family mental health. Every time I see my patients and I ask them a question about their family mental health, a lot of times they have a big stare or they just can't recall because this is not a topic that many people talk about. They're able to talk about high blood pressure or diabetes or cancer in the family. However, the issue with mental health is very in the dark. And it's because many family members from even great grandparents don't pass this information to each other. So I want to be able to empower you and guide you in ways that you and your family can have this empowering conversation about what was mental health in our family. And this will be great for spouses as well, because you're sharing a child with your loved one. And so that way you're able to find out what's going on with your kid if something does happen, if they're having mental health crisis or issues. And when you do see a mental health provider, you'll be able to provide more detailed information about what's going on with your loved one. Here's some couple questions you could discuss with your family, which we will all engage. But at the same time, we have to be very sensitive to those who want to share as much or share as little, because this is a very vulnerable time for people to express themselves. One of the first questions is, who had a mental illness? This is important because people could suffer from depression, anxiety, obsessive compulsive disorder, schizophrenia. So it's good to know who had what disorder. And then the next question I would bring up is, what medications have family members with mental health been in? So knowing the medications is very important because you'll get to know if the medications have helped them out, if it helped eliminate or reduce symptoms, or on the other end, did they get side effects where they're getting headaches, nausea, vomiting? So you want to know these side effects. So when you do see your mental health provider and they're ready to prescribe a medication, you could say, hey doc, my cousin or my sibling had this medication and they had this adverse effect. And so most of the time the doctor may use their judgment to see if this is the route that they want to go with you or just go to an alternative medication due to genetics. Another question I feel is great is to know if people were hospitalized in the family, because the more frequent hospitalizations, that knows about the severity of the illness. And did they get help, or are they seeing a provider to get this treatment? So that's important to know about your family members' hospitalizations. Do we have a history of alcoholism in the family, cocaine use? Just knowing these disorders in the family is a great conversation piece, because this will allow everybody to come together, empower each other, and learn what has affected their loved ones. Because a lot of times people with substance use disorders need to avoid people's, places, and things that contribute to their substance use. So knowing that about a loved one will be very empowering, so you can be a better support of them, and also for yourself. If you're struggling with addictions, you know it's in your genetics and you want to get help. So all these tips that I'm providing in regards to this discussion on family history of mental illness will empower your next visit with your mental health provider so that they could be more equipped to serve you. Don't see it as a downer that, we're a depressed family or we're an anxious family, but take it as, yes, we have this in our family history, but we're a family of victors and we're gonna beat this. Thank you for your time and hearing my message. Please share this with your family, friends, and colleagues, because us all together, we could break down the stigma of mental illness. And you could follow me on YouTube, Facebook, Instagram, and Twitter at GPSMindset. Thank you for your time, and see you again.